Hello and welcome to the Faculty Lounge. I'm Paul Hauptman, Dean of the Graduate School of Medicine, and I'm delighted to have Dr. Lee Wilson with us today. Dr. Wilson is the chairman of the Department of General Dentistry and also the program director for the training program here in general dentistry. Dr. Wilson, welcome.
Thank you very much for having me. Good afternoon.
We're very interested in finding out more today about forensic odontology. It's a very unique program or series of programs here at the Graduate School of Medicine, but first we probably should begin at the beginning. So I took note of the fact that you're an Alabama boy. You went to college in Alabama, you went to dental school at the University of Alabama, so I won't start by asking whether or not you support the Crimson Tide. Instead, I'll ask you about your decision to pursue an academic career, which is not a common pathway, I suppose, coming out of dental school. How often does that happen? What made you in particular decide to take an academic path to come to the University of Tennessee Medical Center and the graduate school?
Yeah. Well, when I graduated from dental school in 1987, I came here to do the program that we still have. It was fairly young at that time, but it's called a general practice residency. And it's a one-year program with a two-year option. I opted for the second year, and so I stayed 2 years here, never thinking that I would stay here, but go back to South Alabama to practice. But throughout that second year, I become more involved in mentoring the first-year people, and there was a faculty change at the end of my second year, so they asked me to stay on to do that, and I've just grown up with the program. I will start my 30th class of residents at the end of this month.
Congratulations. And that's a large cohort of practicing dentists out there now.
Yes.
That you're responsible for.
Right. And so I think when you ask the question about how many people stay in academics, it is a small percentage because the vast majority of people will go into private practice, or they will go on into a specialty of one of the 9 different specialties of dentistry. But we're able to, at least on a full-time basis, get a small percentage, but then a larger percentage may come and be, like people that settle in this community will be part-time faculty and stay involved with the program over the years.
Well, you mentioned 9 specialties of dentistry. There is a 10th, the 10th that I want to talk about today,
Yes.
which is forensic odontology. So it's very unique, and the offerings here are really remarkable. It struck me when I began working at the graduate school that we had something that was of a national stature. So let's begin with a definition. What is forensic odontology?
So the absolute definition of forensic odontology is the forensic study of teeth. And so there's different areas that make up that study. One would be doing comparison of anatomic structures and stuff pre-death and after death to make common points to know positive identification. So that's one of the big things in forensic odontology. The other things are doing mass disaster. Mass disaster victim identification is one of the big areas of forensic odontology that is involved in identifying large numbers of people. Like in the 9/11 disaster, there were multitudes of forensic odontologists that went to New York to help sort through things and make identifications there. Most all types of disasters that may involve just a couple of people to 11 or more are responded to by forensic odontologists through the medical examiner's offices throughout the country.
So are they subcontracted by medical examiners? Presumably it's not a full-time
It is
endeavor.
not generally a full-time endeavor, although in some large metropolitan areas such as Chicago, New York, something like that, they may have a full-time forensic odontologist that they have on staff. But generally it's a passion that somebody has that they do outside of their normal practice. And somebody that has a true passion may go through the boarding process of becoming board certified. And most medical examiners' offices that are accredited by name have to have a forensic odontologist on their staff to be able to be accredited.
So here at the graduate school, we offer a fellowship. We'll soon offer a master's degree program and a series of courses, including one coming up this summer called All That Remains. Who signs up for these, and what's the process for doing so?
So when we first started, this will be the third time this is offered. In the first course that we did, these courses are mimicked somewhat after what used to be done in the Armed Forces Institute of Pathology. That was a forensic odontology course. It's a week-long course, and it was open to dentists as well as other dental professionals that would come that have the passion. And they come and stay for a week. Each day is dedicated to a different discipline in forensic odontology. This year, it's limited to dentists only, so it's a smaller, more intimate class, and they will go through the different disciplines such as mass disaster victim identification, civil litigation, bite mark analysis, the aging process, age estimation, both from babies up to adults, and then they do all of the things that come with the computer work now that is done with that. There are certain programs that allow you to compare information that's entered on a scene to things across the country for identification processes.
And it's really a multidisciplinary approach, if you will. I noted online, among other objectives include learn to participate in expert witness programs, practice human remains recovery in the field, and so forth. So this is a very broad area, actually. One of the unique things about the program here is the presence of Maury Marks, who's an anthropologist by training. He has a PhD in anthropology. Tell me about the role that Dr. Marks plays and how an anthropologist can contribute to this field.
So the history of that is very interesting in that Dr. Bill Bass, who is a world famous forensic anthropologist that developed a lot of the different ways to identify time since death, Maury was one of his PhD students, 25, 30 years ago. Maury's PhD work was in the area of dentistry and how to age teeth and section teeth and the embryology of teeth. So that connection was made with us in the early days. Dr. Bass, when he was still very active, would bring cases to our dental office and clinic to help with identifications. When Dr. Bass became emeritus, Dr. Marks started doing that. And he and I really figured out that that was something that we could grow on. And so since he had such an interest in teeth, he became part of the faculty at the medical center and then eventually became full-time faculty in our department. And so Maury helps to spearhead all of the forensic activity that happen, even though there are other people that are board certified forensic odontologists that come and do the didactics and stuff. Maury has a lot of talents in that he is a age estimation expert, especially in the area of infants and fetus age estimation. And so that all has become part of our operation. Being a PhD, he also helps to spearhead any of the scholarly activity that happens in our department, either on the forensic side or just on the general dental side also.
Well, so not only do our departments of general dentistry somewhat unusual, would it be fair to say we're probably the only one that has an anthropologist in the department, or is that common?
Not common.
No, I wouldn't think not common.
I think that he's the only one that I know that is parked in a general dentistry department.
I know that the group was involved with identification after the Gatlinburg fires.
Yes.
Can you tell us something about that?
So the fires were very devastating to the area of Gatlinburg, and unfortunately there was loss of life. And so all of the victims were transported here to the forensic center, which our team went and did all the post-mortem and then compared the ante-mortem records that they had to make all of the identifications. And that's one of the things that's important, is to be able to do quick identification for medical purposes, but also the empathy part of families that want to know, was that my loved one that perished in a fire or whatever. They're able to bring some closure to that, and so that was quite disturbing for everyone, but it's a service that we feel that is a good service to have for our community. The forensic center with the forensic pathologists there are very, very involved with our program, as well as keeping us involved in using our services for identification for that, as well as other deaths in the community.
Well, Lee, thank you very much for joining us in the Faculty Lounge today. I think that's really a fascinating insight into a unique program here at the Graduate School, and we certainly look forward to our next session here in the Faculty Lounge. Until then, thanks for watching.